Okay, thank you. Well, good afternoon. Obviously, we're conscious that it's been a few days since our last media briefing, but the timing of today's briefing, frankly, isn't particularly ideal. We're sort of currently a bit betwixt and between, in the sense that the testing data is still coming in to improve the evidence base for the review of the lockdown, whilst we've not yet actually made any decisions on what happens next. So this coming Saturday at midnight, the island will have been locked down for 24 days. And as ever, I will leave Dr. Brink to talk to the data a little later. Suffice, I think, really for me to say that, certainly speaking personally, I think we're in a much better place than I feared a month ago. Our health system clearly has not been overwhelmed, and our ICU has not yet been needed, and we've not yet needed to build an overflow facility or a so-called Nightingale facility. But we cannot be complacent. There is clearly a long way to go before we're out of this crisis. And I was asked recently, well what worries you? Which I think is a very good question. And I think there are two things that worry me. Firstly, that as we feel our way back towards normality and the regulatory environment is changed to allow that, we will potentially face a series of rolling peaks in COVID-19 cases, which may or may not be correlated to any relaxations in the lockdown. And I think the management of public expectation and reaction to that happening and the need to tighten up again if that happened, I think could be very problematic. And I don't really have an answer to that today on that issue, but I'm really just sharing that sort of nagging anxiety with you as we're faced with the difficult decisions of what comes next. And secondly, I have worries about the state of our economy and how much permanent damage will have been done to our economic crisis, to our economic base before this crisis has passed. And that really brings me to the matter of the self-employed and how best to support them at this time. As deputies, Heidi and I, along with all of our colleagues, have received a huge number of representations from the self-employed in the last 48 hours or so, really, I think, illustrating the real fear and despair, actually, that many are feeling. That really came through in the correspondence we've received. Now, I've said many times in the last month before that I will tell you when we've made mistakes, but actually on this issue, I don't think we have made any mistakes. I just think that things have moved on, and they've moved on very fast. The package of business support measures, which were actually only approved on the 24th of March, and what are we today, the 15th of April. So only on the 24th of March, they've frankly been overtaken by the wave that is this crisis, and that wave has broken financially over the heads of many in our community. So I think we're playing catch up, really. And neither are we alone on this issue. I think if everywhere really is struggling with how best to support this group of their community, to how best to support the self-employed. And I think that's no great surprise, really, because it covers such a wide range of economic activities and business structures. In some cases, of course, owners will be taking a salary from a corporate structure, and that will be supported by the payroll support scheme, whilst in others, individuals will be taking drawings, and of course the nature of each business will differ as well. So the support is working for some but not for others, and I actually had a call at 7:30 this morning from one self-employed business owner who questioned what all the fuss was about, as having gone through the application process, a decision had been quite quickly reached in that particular case, resulting in income support being payable. And of course income support may well be part of the solution for many, and they should of course be exploring that as part of their dialogue with the business support team. But I know also that the team that are handling the applications is struggling with the volume, and I've got absolutely no criticism of this. They're doing an absolutely fantastic job with a completely new function. They've been pulled together to handle this, and they are, they're swamped, and that isn't to be a surprise. And the chief executive will speak in a moment on this in a bit more depth. So, and whilst in normal times, I think that might not matter to have that delay. Right now, many self-employed, I think, simply they don't have the luxury of time to wait. So we have moved very quickly, and we've reviewed the support available, and rather than looking to create new approaches, we've decided to work with the existing measures that are already in place, and we've decided that it is possible to extend the current payroll scheme to include all business owners, including the self-employed, which critically would achieve the important objective for us of a rapid implementation. And further details will follow, I hope, later today, and Paul will also speak a little bit more on that in a moment. Work has also begun on more automation to the process via greater IT. At the moment, it's a very manually intensive process as it stands. We've achieved that with income support in very rapid order, and that's great. This is a high priority, and working with our business partner Agilicis, who are doing a fantastic job supporting the states, of course, remotely themselves. And in the meantime, further resources are being added to the team to speed up the claims processing, and as I say, Paul will speak to that in a moment. I'm just going to close with two other developments. Firstly, the launch of a COVID-19 response appeal. This is in response to the many offers of help that have come in. It's been amazing from individuals, companies, organisations, and I think it does provide a route which people have been calling for, which enables members of the public that if they wish, support our response to the crisis. And again, further details on how to donate will be available today. Secondly, Heidi is going to speak to a couple of changes which have been agreed in relation to Sark and Alderney. Once again, these are, I think, should be regarded as tiny steps back towards what we once all knew as normal. But I think it also may help us as we make the further difficult decisions ahead of Saturday's review deadline. We do plan a further press briefing on Friday, and I hope that by then we'll be able to say what decisions have been made in relation to the review. So thank you very much from me. What we're going to do from here is Heidi, and then Paul's going to speak on some of the issues I've spoken about before we then go to Nikki and Peter. So Heidi.
Thanks, Kevin. I'd just like to start with a big thank you to a number of our health and care family who haven't been mentioned and that much during this crisis, but who have had an incredibly important role to play over the last few weeks and will continue to do so. And that is our GPs across the community and across the bailiwick. They really have been on the front line from the very start, and I'd like to thank them for their input into the COVID-19 tactical group meetings, for work in supporting the care homes, and in particular the work done at what we call the COVID-19 surgery, which was at the Longfree but has now been moved to Chest and Heart at the PEH campus. I'd now like to focus on Alderney and Sark. To date, there have been no positive cases identified in either island. Sark in particular has imposed incredibly strict measures in terms of entry to the island for some time, with anyone arriving since the 20th of March being taken by the Sark ambulance and placed into mandatory self-isolation for 14 days. Following a request from the Chief Police of Sark, together with proposals as to how it will be monitored, the Committee for Health and Social Care today has authorised that work can recommence for outdoor workers, either working alone or in pairs, subject to social distancing measures being in place. Now, Public Health have carefully considered the proposals, and it has the full support of the Director of Public Health as a means of a pilot transition from firm lockdown, with a clear safeguard that it would immediately be revoked in the event of a single positive test. In respect of Alderney, we had a request from the States of Alderney that certain food establishments open their kitchens due to particular social need. The Connaught has reached capacity to provide food for Meals on Wheels there. As a consequence, the committee has agreed to authorise 4 establishments to provide prepared food as long as they do so with lone workers in the kitchens and the food is delivered by Meals on Wheels. Again, this has been supported by the Director of Public Health. I think it is important to make it clear that these are limited exemptions specific to our small islands to meet their unique needs. And as Gavin has stated, we are looking at what we do for the bailiwick as a whole over the next 2 days, and we're providing that information on Friday ahead of the CCA regulations expiring on Saturday.
Thank you very much, Heidi. Paul.
Clearly, as outlined by Deputy St Pierre, focus for this week has been addressing the issues we've been experiencing in business support. We know that the first set of economic support measures that have been put in place are not addressing the needs of the self-employed and sole traders. As indicated by Deputy St Pierre, the situation has now been reviewed by the economic group led by Deputy Trott, and a number of important changes have been made. So for clarity, the coronavirus payroll co-funding scheme will be extended so that self-employed business owners who are not normally on the payroll of the business will now be able to apply for payroll co-funding. This recognises the fact that some self-employed business owners draw their income from the business whilst not being on the payroll of the company. Sole traders who don't have a payroll will now also be able to claim. As with the payroll co-funding scheme, a self-employed business owner will be entitled to claim 80% of an amount equivalent to Guernsey's minimum wage. In addition to these changes, the scope of business activities that can access both the Small Business Grant Scheme and the Coronavirus Payroll Co-funding Scheme have been widened. The details of all these changes will be published later today. The backlog of inquiries that have built up, although unsurprising due to the volumes and complexities, is not acceptable. We are adding people to the team, and by the end of this week we'll have upwards of 20 people working directly on case management, with the businesses to get them the support they need now. If we need to augment that further next week, we will do so. Many businesses who are able to operate are doing so remotely. The public sector is no different. However, this is a completely new team that did not exist 3 weeks ago. As no two situations are the same, putting in extra call lines and making the process more efficient will give more opportunity to guide the applicant through the process. This week we are installing new technology in the form of a virtual combined call centre to help us manage the high numbers of inquiries we are receiving. Doing this virtually means we can operate the call centre with the increased numbers of staff needed without putting them at risk, and in doing so have the call lines open for longer. We hope that these operational and policy changes, approved by the Committee for Policy and Resources only this morning, will address many of the concerns reflected on social media, in calls directly to us and through the community monitoring tool. I'd just like to mention that I'm delighted to say over 4,900 islanders have signed up so far for the online community monitoring tool. This equates to 7.6% of our population and provides data to give a significant representative sample. This data helps us to understand what is happening in the community, and as well as the information that we get direct from you in the form of emails, calls, and of course monitoring social media. At the moment, our data is reflecting the financial strains seen in the business sector, and we are responding to that. We do encourage as many of you as possible to complete the form online, as it will help us understand where we need to channel our resources and our support for you. You can find it on www.gov.gg/coronavirus. Thank you.
Thanks, Paul. Okay, Nikki.
So thank you very much. First of all, just to start with the regular update on the number of cases. So we've got 228 positive cases now, and a total of 69 of those have now recovered. And all in all, we've tested just under 2,000 samples. I think what has been really encouraging in recent days, what we've seen is that the measures that we've put in place have been highly effective. We're really starting to see a flattening of the curve. So that's really, really encouraging. We've also done a bit more work on the demographics of people who have COVID-19 in the bailiwick, and the age range is anything from 0 to 99, and we now know we've specifically looked at the under-18s, and only 4% of our cases occur in the under-18s. So really important. We've looked at our male-female split, and it's 62% female, so we have a female predominance now. We think that's probably related to the two clusters that we had in the care homes, as well as to the staff that we identified in the care homes as well. So we think that accounts for our female predominance. So we think that's important. Some of you asked me last time about the cases by categorization, and we've had a look at that in more detail as well. And we've been waiting till we have enough numbers to make some robust analysis, because it's not good to analyse on really small numbers, because there'll be huge confidence intervals then. But what we know is our most rapidly growing category are those that are diagnosed through contact tracing. Now that is really good news for us. Obviously, it's not good that they've been diagnosed with COVID-19, but these are people that we've identified that are at potential risk. We put them into quarantine, and if they become even slightly symptomatic, we go ahead and test them. So that's important. Our most common category now is the identification of cases in contacts of known cases. So really important. Other groups of interest for us is our travel group. So our travel group is going down in numbers, and our community seeding was initially going up. That sits at about 12% of cases now, but appears to be flattening off. So really important trends, and we've published that on our website so that everyone can see what we've done. We've published it both as a pie diagram and absolute numbers, but also a graph so you can see the trends over time. The other point that I was asked about last time was the point about our rates of antibody testing. And we talked about our rate, and we know that we're testing about per head of population about 26 per 1,000. And last time I quoted the UK at about 2.7 per 1,000, and I was quite rightly asked about testing rates in France and testing rates in Germany. So we've gone back and looked at that, and the testing rate in France is about 5 per 1,000, and the testing rate in Germany is about 16 per 1,000. So at 26 per 1,000, we really do have good testing rates. However, there are other small island jurisdictions or smaller jurisdictions that also have good testing rates. Luxembourg, we believe, is got a good testing rate. We haven't been able to get a hold of the absolute figures, and we believe Gibraltar is doing well as well. So looking at that, I think it just shows sometimes our smallness actually counts in favour, and we're actually able to get our policies going really quickly and act in a very nimble way. So I think from our perspective, I think that's been encouraging as well. We've been asked a lot about exit strategies and how we're looking at those, and we have been looking at the principles of what we should be doing when we eventually move on, and there are a number of issues we've considered here. One is, do we have lockdown until a vaccine's developed? The second is, do we use the imperial model of adaptive immunity, where, for example, you use triggers to go in and out of lockdown? Do you have a gradual ease of lockdown? Do you use antibody testing? So there are a number of things. Or do you use the testing, contact tracing, quarantine? So we're going to be looking at all of those together in the round, and over the week been developing more issues or developing more strategies as to where we progress from here. So this is actively under consideration, but we need to consider that more during the course of this week. So something we're considering and something we'll bring back to you later on. But I hope I've answered most of the questions that you asked me last time. But at the end, more than happy to take more. Thank you.
Thank you very much, Nikki. Peter.
Thank you. Well, the hospital report's starting to feel a little anticlimactic, and I really hope it stays like that. But I'll give you the latest. We've only got 8 patients in our COVID ward at the moment, and doing well actually. So that's good. We don't have anybody in the COVID intensive care. It's all ready to go. Since we last spoke, we've had another delivery of 4 ventilators, which is really good. So we've got more ventilators than we had before, and we're trying to get more. But as I say, at the moment, we don't have anybody with COVID on the island yet who's needed to go onto a ventilator. So we've done the preparation, and we hope not to need all that capacity. The front line, though, is still the care homes, really, and I just need to give you an update on that. You know that you've heard the numbers from Nikki. We've had 2 homes really quite badly affected with it, and one of those is still requiring quite a lot of support from health and social care in terms of staffing and nursing support, particularly at night and things. So we're continuing to help with that. All the homes are getting the PPE that they need, the personal protective equipment, and we're helping with that. So I think the situation in the care homes here, just like we're discovering it to be in the UK, unsurprisingly, I'm going to say, is that the care homes are the front line against COVID. And when it gets into a care home, it's people are at risk. And this is a vulnerable population, and we have to take these extreme measures to try and keep it out of the care homes. And when it gets in there, we have to do a lot of supporting. So we're doing that. Update on our personal protective equipment. We'd like more, but we've got enough to be going on with. We're hoping for another delivery of surgical masks today, and I really hope that arrives. Surgical masks are the thing we're most living from hand to mouth on, really. But we have supplies in. We're managing them really tightly with that cell that's looking after ordering, procurement, and distribution of the equipment we've got. And so I'd say the position at the moment feels like under control, reflecting what Nikki's done. And thanks to everybody who's been engaging with the public health messages to help us keep it that way.
Great. Thank you very much. Okay, so we'll open up to questions. As last time, we've got some from the my coronavirus questions as well. So we'll alternate in and have some of those as ever. Nice and loud, and if you introduce name and organisation for your first question for the benefit of those listening in, please. Thank you.
Hi, Rosie Alsop, Island FM. I think I know the answer to this, but just for clarity, in the UK yesterday there was a lot of discussion about how the total number of COVID-19 cases had been counted according to people who'd passed away in hospital and not counting care homes. Are you able to clarify the situation as for Guernsey, please?
Yeah. So if we were to count in the same way as the UK, we'd be telling you that we had 1 death. We honestly believe that we need to have a very open, transparent message for the bailiwick. So not only do we count the confirmed COVID cases, but also the suspected COVID cases as well. So just perhaps to clarify what we mean by a suspected case, these are people that have died that we think COVID could have contributed to their death. It might have been a bronchopneumonia, bacterial type pneumonia, right at the end, but we think that COVID might have played a role along that pathway. So we feel it's really important to have a comprehensive reporting, and so we know exactly what's going on in the bailiwick. So that's why we say that we've had 8 deaths, and that if we were reporting along the UK lines, we'd be telling you that we had 1 death.
Thank you.
Okay, thanks, Rosie. Next question.
Hi, Laura Clayton, Bailiwick Express. I've got another question actually probably for Dr. Brink. We're hearing that a number of doctors' surgeries have been affected by coronavirus, with one in particular with a number of staff currently off ill. Are you able to give us any details about that?
I can answer. Do you want to answer it?
Sorry.
When you say the surgeries are infected, I think we mean some of the doctors have been in contact with coronavirus and tested positive. That's happened. It's not new. We have had doctors and nurses who've come into contact and tested positive for the virus. So yes, in primary care they took sort of preemptive action on this, didn't they, by opening a surgery to look at the respiratory type symptoms, and so they took that action really early, and that's great. So people were seen there with personal protective equipment being used, and that's still going on at the Chest and Heart Clinic. But that doesn't mean that people who go to the other clinic are completely risk-free for the staff there. So they're taking appropriate precautions at the other practices as well, doing as much as possible remotely, and you know the doctors and nurses who get it, we test them. When they become negative, they can rejoin the workforce. But yeah, that has happened. It's still. I'm going to emphasise this actually. If you need medical help, please get it. We are seeing some people presenting late with things that would have been simple to treat if they presented in a normal way, and really, you know, limb-threatening type injuries that could have been prevented because people are frightened to go to their doctor and frightened to come to A&E, I think. So please, if you think you need medical help, get it. It's perfectly safe to get it. We'll look after you. Everyone's taking the right precautions, and staying at home, hoping it's nothing, isn't the way to manage.
Okay. Thank you very much. Rob, do you want to come in with?
Yes, so Rob Moore from the States Comms team, and we've been collating the My Coronavirus questions, and we still have a few areas where we're seeing lots of questions come through. So one of them is on the exit strategy, and I'll just give you a few of those questions that we've had. One, are we putting plans in place for a staged release of lockdown, and if so, what would that look like? How will we go about opening our borders, and might we see some kind of Singapore-style testing at the borders? And in terms of the long-term strategy, what exactly is it? Is it to continue flattening the curve? Does it rely on an antibody test? And does it ultimately end in a vaccine?
Do you want to kick off on that?
Just a few. So perhaps the last one, ultimately end in a vaccine, absolutely, is that we would like to see a vaccine available. And as part of the public health team, we've been looking at all of the vaccines that are being developed and making sure that if there is one likely to become available, that we engage earlier rather than later. So I think that's really important. I think what we must focus on is the fact that our strategies to date have been highly effective. So if we looked at our initial trajectory, we were probably looking at a 2-day doubling of cases. That has been flattened out way beyond a 5-day doubling. So the mitigation that we've put in has been extremely effective. And the gains that we've got from that mitigation, we mustn't sacrifice those. So it's really important to balance that. So when we then look at an exit from lockdown, and that's something that when we went into lockdown, we already started planning as what we'd do, how we would move out of it. So it was part of our initial planning. You don't just go into lockdown and then say, okay, what am I going to do? You then need to sort of say, well, we're going into lockdown, this is how we're going to think of progressing. So central to our strategy has always been our testing strategy. It's been test, quarantine, and contact trace. And the fact that most of our cases are not identified through contact tracing shows how effective it is. We're having very little community seeding at the moment, 12% of our overall cases. What we've done whilst we've been in lockdown, we've now broadened our clinical definition. So we did an analysis of the symptomatology of our first 200 patients. And we felt the triad of cough or fever or shortness of breath was too restrictive. So we broadened that, which is why we published our extended symptomatology. That enables us to be more proactive in detecting cases. So whilst we then use that test contact trace, we've got to think of what else we can do if we're looking at a move out of lockdown. So the other thing is the adaptive immunity. So adaptive response. So the adaptive response is when you slowly come out of lockdown, you think, what are the triggers that are going to put us back into a firmer lockdown again? And Dr. Raby and myself had a meeting this morning looking at what those triggers should be. Should it be a hospital-based trigger or should it be a community-based trigger? There's no right answer, but what we will do is look to design something that feels right for our local population. Easing off measures in a stepwise way where then you can pull back is another. So we don't think there's a single, well, we're going to do that to move out of lockdown. We think ultimately what we'll probably use is a combination of our test, contact trace and quarantine together with some sort of phase program, together with an adaptive trigger to pull back if we have to. So that's the type of thing we're working up. The actual detail and the timing of that is unclear at the moment, and we need to think about that really carefully. So that's what we're doing at the moment, and I think what I'd like to emphasize is we mustn't lose our gains, is we have flattened that curve. It really is really impressive as to how the numbers have decreased and how our initial doubling time of around about 2 days is way beyond 5 days now. It's absolutely flat now. So that's been really encouraging. And we hope to put some of that information in the public domain as well. We've always had the attitude that this is our information. It belongs to the bailiwick of Guernsey. It belongs to all of us. And as long as we are happy that the data is robust and isn't subject to skew, is we will put it out for all of you to have a look at because it belongs to everyone. So okay. I think I've tried to answer most of that, Rob. I'm not sure if I did all of it.
Yeah, I think perhaps the only one was in relation to the borders and what role they may play. And again, what Heidi and I and others from the Civil Contingencies Authority will be doing is obviously taking the advice from public health and as one of our inputs, and we'll also be needing to think about the other dynamics at play in the mental health and well-being of the community. We need to be thinking about the economic well-being of the community. What we obviously trying to avoid is a public health crisis becoming an economic crisis, which becomes unmanageable in itself. You know, we're now juggling two crises in effect. So that's an important factor for us as well. So thinking about as the options are presented to us, well, what are the what's going to have the biggest impact for the lowest risk. It will be, is likely to be one of the considerations we have. And also, the going back to the issue of the borders, this is a unique strength that we have to be able to control so effectively who comes in or out. Really, the numbers now are very, very low, and they are only essential people moving in and out for very good reason. And that, again, is something that I think we are unlikely to want to lose that control for some time whilst this is raging on around us in other jurisdictions around us. If we've have indeed been able to flatten the curve, as Nikki has said, then clearly we want to keep it that way. And one way to do that is obviously not only the measures we have internally, but also controlling infection coming in from outside, given that obviously was the original source of this coming into our community. Good. Sorry, next question.
Are you able to tell us...
Do you mind? Just for the...
Oh, sorry. Yeah, sorry. I forgot about that. Sorry, is it you or me?
No, she's just to say who you are.
Okay, sorry. Ewan Duncan, BBC Guernsey. Sorry for all that.
Yeah,
are you able to explain how sustainable you think the financial support is going to be for island businesses, and how long do you anticipate being able to offer that after we come out of lockdown? Will it be a couple of months, 6 months, a year?
A stunningly good question to which I haven't got the answer. I just don't know is the answer. I mean, I think it depends so much on what happens over the next few days and few weeks in terms of our ability to be able to re-engage the economy, which parts of the economy we can re-engage, which parts, again, need to stay in this furlough term for a longer period. I think that's perhaps one of the biggest factors. I think what we can say is that I can say with confidence is I think that the level of support which is available will definitely not please everyone. It can't, and that's the nature of all the business support we've put in. Is it's a pretty blunt weapon, and all it can do is mitigate some of the enormous financial pressures which businesses are feeling, and that in essence is. Bearing in mind what we're doing here is, we are redistributing from one part of the community to help support another, which of course is exactly right and exactly what we should be doing at the current time. But we've got to be thinking about, as your question implies, the long-term implications of that and how long that's sustainable in the context of the pressure on budgets generally and our reserves and all these things. So these are much like the public health questions. The question of economic and financial support is. It's a huge challenge with another raft of very difficult decisions, which are not going to be universally popular. We can't possibly hope to achieve that. So we will do the best we can. And again, as we think about coming out of lockdown, as we make those judgments as to which parts of the economy can be working again, that I've talked about making mistakes. That may be where the mistakes come. That something will come in too early or come in too late, and that's where we will need to be adaptive, to use Nikki's language, and keep responding to the environment that we're in. So I'm afraid it's a good question, but it's one I don't really have the answer to. Please.
If I could add to that, I think we've taken some really positive steps and early decisions since this crisis started. One of those was going into our lockdown earlier than many others, and I think that's paid dividends following Dr. Brink's strategy. Secondly, I could absolutely endorse, we started our recovery thinking more or less the same week as we went into this crisis emergency mode. And I said, as Deputy St Pierre points out, the financial crisis is almost as big now as the impact on health, because one obviously is affected by the other. So we are building and working very hard across government now to build a recovery plan that overarches, because we can't just concentrate on the economy, we can't just concentrate on public health. And we've also got to look at the provision of services that the community need, and do we need to make an adjustment on that? So actually we're trying to collect this in an overarching recovery plan that we can take going forward, and we'll probably be able to talk more about that in the coming weeks.
Yeah.
Sorry, just to pick up on the point you just said there. Is now the weight more towards thinking about the economy rather than health, because we've thought about health for so long, and it feels like we're in a good position now that the more we leave the economy, the harder it might be to recover.
Heidi.
I think, as Dr. Brink said at the very outset, it's a balance between keeping islanders safe and keeping the island running. So it's always been about public health, yes, but we could just say, well, right, we'll lock down forever then, but we can't. We know that's never been the case. That's why we've always had a consideration as to what any strategy should be at lockdown. But what I can say, for the evidence shown through, I know it was about 100 years ago, but it was a Spanish flu, that those states that took tough measures at the time had their economies bounce back far better and stronger than those that didn't. And I think that's something we do need to bear in mind. And it's going to be that tension between health and the economy, but at the end of the day, we have to be led by the evidence and the information that Dr. Brink gives. And she's a director of public health, but she is very well cognizant of that balance. I know, because she said it from the very beginning at the very first Civil Contingencies Authority meeting we had on this.
Yep. Okay.
Danielle Keneally from the Guernsey Press. It's a question for Paul. I was wondering, I noticed on the state's website the financial support for businesses has reached 700 for business and traders. How many are still waiting to receive the support, and how do you prioritise?
Yeah, I think it's a really quick question, actually. We're not well north of 700 now, and of course, statistically, if we just measure it in a percentage of cases, you might see a negative movement, because as soon as we're actually processing cases, we're getting new cases coming in, and no doubt with the extended measures that have been approved today, that we're going to see a further escalation of cases coming forward over the next few days. So what we're hoping to do is break down more information so that we can demonstrate those that have been processed, those that have been paid, and those that have been received new, so that we can demonstrate how we're actually working through that case management in terms of business support.
How are you prioritising, if you are?
In terms of the teams, they're obviously breaking it down in terms of the type of cases they've got. Obviously, there is everybody, whether I suggest a small business or a large business, it is important to those people, the person running their single or the sole trader. So we are trying to apply as much as we can an immediate response to the case management, but of course that's only as fast as we can work through the caseload, and it is very high at the moment.
Okay, next question.
I've got a follow-on actually
Laura.
to Danielle's. This came from a reader actually of Bailiwick Express, so I'll have to paraphrase from memory. But how many staff within the civil service have been redeployed to work on the services that you're talking about? I mean, have you had to move many staff across departments to be able to man the virtual call centre that you're setting up and things like that?
Yeah, I think it's a really good question, actually, and it goes back to something I said in my statement, that this is a complete redefinement of work. It's a new tasking, and of course, if you were simply, it's been quite an exercise shifting the majority of administrative work we do in the public sector to people doing that at home, working remotely. I think if we were normally setting up a scheme that affects so much of our business on the island, we'd have normally had working group think tanks to see how we'd do this properly. And I think it goes back to a point Deputy St. Pierre made, that actually put the scheme and the support measures in place very quickly. We are now having to respond to the change, and particularly what we're hearing in the feedback from sole traders, self-employed, and from business more generally. So we are working on that as a shift, so that we're shifting some of our workforce to do that. But of course, we're caught up with this the same as everybody else. So Frossard House, Edward T. Whedon House aren't full of civil servants working on this, sat side by side. We've also got to protect the workforce. So we're developing these processes, these schemes, these guidelines, these protocols by everybody working virtually. So it's quite a task, but we will add to people. I think, as someone put to me yesterday, we could put another 10 people on it today, but unless we get them familiarised and understanding of the case management and indeed the complexity and the individuality of all these cases, then actually I would suggest that's worse receiving a call with someone that can't really progress it. So we're just trying to hone our competence, if you like, in that area.
I think sort of one practical issue in relation to this is, and I know this is really difficult because of putting myself in the shoes of the individuals that are affected, but actually to avoid making further contact to say what's happening to my case, because that's putting more pressure on the teams in terms of simply fielding calls which are, where there isn't any further development. And I think that's a real challenge, because it's completely understandable that people are feeling left in limbo and nothing's happening when actually it is in the system, but actually your resources are being pulled away. And actually I think one of the consequences of today's announcement again could be a deluge of sort of general inquiries, which is again potentially could risk clogging up the system. So I would encourage people in the first instance simply to go to the website, see what material is publicly available, and then follow that process there, rather than sort of bombarding individuals or the system with generic queries. So work with the material that's put out is my plea, to try and help us help you, is really the key message. Next question. Yes.
It's for Dr. Raby. You mentioned that PPE stocks aren't great. What contingencies do you have in place?
We've got hundreds of thousands of bits of kit ordered, and we're tracking all of those. And we're part of the NHS supply line, so we're included in deliveries from them. So we've got fingers in every pie. We've had offers of help from on island, which we followed up actively. So for example, you've heard already about people who've made us visors, and we know that there's a lot of volunteers have made cloth masks, which are suitable not for direct contact with the COVID case, but for community use if in terms of protecting some people. So we've got all of that. There's other things we've looked at. Can masks be reused after sterilisation? And there's ways that can be done. It's really not something we want to get to, because you should have a new mask when you need it. And that's the position we're in, and that's the position we plan to stay in. But if we get there, like other places, there's things we'll have to look at that aren't desirable. And we've got those sort of contingency plans in place. We just hope we never need to draw on them.
I would say also, just build on that in terms of politically, we have a regular dialogue with the Ministry of Justice, with Lord Keane as the responsible minister, who I speak with weekly, together with colleagues from Jersey and the Isle of Man, so that there is an opportunity to share our challenges and experiences, recognising that we're all drawing on, to some extent, on the same supply challenges, but also making sure that, as Peter has said, we're part of the NHS supply line, and therefore are entitled to receive our fair share of that. It's a real challenge because everybody is stretched, but there are those mechanisms there, together with the appropriate contacts into the Department for Health and Social Care in the UK as well. So I think we've got the right political involvement as well, should it be necessary, to help us meet any particular bottlenecks as and when they occur. So I'm confident that we've done all we can do in making that challenging.
Yeah, I was just going to say, I think we've got all bases covered at the moment as far as we possibly can. If anybody's got any bright ideas, we're always happy to listen, because I mean, we're not saying that we know everything, but from all I understand and hearing from Peter and Nicky, there's our procurement teams have done a fabulous job.
Yeah, it's not a message of complacency. It's definitely an issue that we are watching with care and caution, and we'll continue to work with it. But as Heidi said, some of the contacts we've had in relation to procurement have come from the community. So again, if anybody feels that they have got a solution, they can help in any way, all of that will be looked at. It will be taken seriously, and if it is an appropriate contact that can be followed up, we will use it, which is what we've done already. Next question. Yeah, sorry, do you want to go to Rob and then we'll come to Ewan?
Yeah, we've had a lot of questions through on my coronavirus questions on the financial impact that people are feeling. A lot has been covered already, but I'll ask one that's just slightly different. Can any mandatory instruction be given from the states to mortgage providers, private landlords, loan companies, or insurers as to how they should be assisting customers or tenants, or is the states really only able to appeal to their better nature?
I mean, I think there are, looking at other jurisdictions, there have been a number of legislative solutions to that. But again, I think they're not without their challenge, because in a sense it just moves the problem further down the economic chain, as it were. And I think, as I've said in this forum before, actually there is no, you can't safely assume that a landlord is not without their own financial challenges. So to impose some kind of moratorium on them, when actually in some cases the tenant may not need it anyway, and then just put pressure on the landlords, all we're doing is shifting the problem around. So I think in the first instance the dialogue is the appropriate response, and actually I think in most cases the feedback I'm getting is that is getting the right response. I participated in a call first thing this morning with the banks to get feedback on how the loan guarantee scheme was going in terms of the dialogue between banks and businesses. And most of it was very encouraging to hear actually that most of the applications for loan support were being met by the banks. We also did talk about mortgage deferrals, and again, in the vast majority of cases, the banks are allowing that 3-month deferral window, which they intend to use to then engage with the mortgage holder to say, okay, we've now got some time to sit down with you and work out what's the nature of the problem that you, as an individual, or as a business, or a couple, or whatever it is, have. And how can we work together to manage our way out of that? So it was a much more positive story than I was perhaps expecting in terms of what's actually happening on the ground. So I think again, in a community of 63,000, there will always be a story somewhere which doesn't chime with that experience, but the general experience, I would say, is working. The legislative tools can always be deployed if it's necessary, but I'm really don't feel that there is an evidence base that would yet justify that. Next question. Ewan.
A couple of questions for Dr. Brink. What was your position on Jersey building a new hospital there to cope with COVID-19? Is there plans to do anything locally, or could we utilise facilities we already have, such as King Edward Hospital or Worcestershire, if it came to that?
So that's something Dr. Raby's been working on, so I'm going to pass that one on to Dr. Raby.
We can be overwhelmed. Any health system in this crisis could be overwhelmed. So we've been doing the planning, and at the moment, and we've got detailed modelling. I need to say that the public health team have throughout this whole episode have been doing the modelling behind the scenes, and we've had access to really good modelling of what might happen, and worst case scenarios and likely scenarios. At the moment, We've expanded the bed base in the Princess Elizabeth Hospital, and we think we've got a way to do that further if we come to that point of being overwhelmed. And we think we can use one of the areas of the hospital, share staff who are already in the hospital to staff it, and expand the bed base there up to a total of 70 from a place that currently has 24 patients in. So that gives us, by population numbers, quite a big expansion capacity that we can draw on if we need to. We can also fit another 10 beds around the physical hospital. So we can expand quite significantly in the PH site. That's really important to us because we've got staff there, we've got oxygen there, the things we need, and that'll be our first port of call. If we need to go beyond that, we're doing the work, we've got the modelling, and we're doing making the contacts. We know exactly how we would do it, and what we don't know we're working up. So we're on the case, and I really hope it doesn't come to that.
Heidi.
Yeah, I think the biggest challenge of having an overflow hospital, or whatever you want to call it, Nightingale Hospital, it's all very well having extra beds, but you've got to man them, and that will always be the bigger challenge, I think. I mean, you can pay lots of money for lots of beds, but if you haven't got people to look after patients, that is a problem. But as I say, that is the whole contingency plans are working on that. It's not stuff that's been published, but it's definitely work that's been going on in the background.
Yeah, it's certainly an issue that the Civil Contingencies Authority is concerned to ensure that it understands what the trigger points would be for any expansion if required. But the first priority clearly has to be to maintain the current good progress, which has been led by the current strategy of being able to contain where we are and do the contact tracing and testing and all those other things. And again, this of course is where the public plays such a critical role in the adherence to the public health guidance and advice, the social distancing, and very much the stay-at-home message. Even if we are able to release parts of the community to go back, it does not mean it's going to be business as usual for some considerable period of time. There will still be a need for the vast majority, I think, to be staying at home in some form or other, or even if they are going to work, they will be going back. They will be travelling from home to work and then back again, and the normal life that goes on around that commute would not be. I don't envisage that happening for some time. So it is critical that the community have engaged so well with understanding the public health message. That if we all continue to do that, then the prospect of ever needing the overflow capacity will diminish. Next question. Laura, and then Danielle.
Okay, there'll always be some situations where the health services in Guernsey just can't deal with them. And we understand that there have been conversations between, I believe, the Ministry of Defence and Jersey and other offshore jurisdictions about doing medical evacuations. What's the situation with Guernsey? Have those conversations been had here?
There are conversations clearly on a contingency basis, but we've not got any issues at the moment. But yeah, they're all part of contingency. We also use other helicopters when we have the emergencies, and we can't use our normal means of transport. So I mean, it's kind of BAU, but in respect of COVID, I suppose you can put it in that context.
Paul?
Yeah, in terms of our planned contingency arrangements, we have a full liaison with the military in the UK, including the Resilience Forum of the Southwest area, which is the area that deals with the Channel Islands. We have a good relationship, and so therefore there is a set process called the MARAC process, that if we required military assistance, we'd apply from that. But we're not in that particular threshold at the minute, but we maintain every day we meet strategically in our strategic planning, and that's a virtual meeting, and the military from the Southwest sit on that meeting with us.
Okay, Danielle.
Since the new symptoms were announced on Friday, have you seen an upsurge in people wanting to be tested, and if so, has it impacted on the test turning around?
So yes, but we've increased our daily testing capacity. So we've just looked at a run of about 90 samples that have come off. So we envisage that there'd be a surge in demand, and we plan for that surge in demand. So we would hope to keep the turnaround time to 24 hours or just over 24 hours. So we tend to put up 3 runs during the course of the day. The last one we'd take off at about 10, 11 in the evening. And we usually then look at anything urgent at that and then process the bulk of those first thing the following morning. So we're into quite a good rhythm of the tests going up, getting the results, getting them out, phoning them out to individuals, making sure that anyone who's positive knows what's happening. We know that they're all right. We also we text out the negative results. So we're trying to make that process as smooth as possible. So from our perspective, there's been quite a big demand over the course of the last few days. We expected that, and we will respond appropriately, and we're not expecting huge problems. The test is working very smoothly. We're very happy with its performance, And so it's just a case of ramping it up as we expect it to do.
Okay, Rob?
One more back on the subject of businesses seeking support. Do we know figures for how many businesses have applied for the various types of support?
Do you have that?
Yeah. At the minute, it's 2,500 businesses have applied for support. Of course, they're combined of a number of different businesses, self-employed, sole traders, etc.
Okay. Ewan, you had one?
Yeah, I was just going to ask Dr. Brink. Hopefully you answer this time. We know that throughout this you've been forecasting predicted trends of what you think the virus is going to do, how it's going to affect the bailiwick. How happy are you with the figures that you're seeing now? Do you think that the lockdown has helped? Sort of, we've talked a few times already in this press conference about flattening the curve. Do you think this is where you'd expect us to be, and how confident are you moving forward now?
So I think the position we're in is, dare I say it, as good as could be expected, and perhaps has slightly exceeded my expectations. So we're very happy that we've managed to flatten the curve to the extent we have. So we're pleased about that. What I'm very cognizant of is that we mustn't lose those gains that we've achieved. So we're not seeing our intensive care flooded. We're not seeing people concerns about ventilator capacity and so on. So we've done really well from that perspective. But I think it's a huge credit to the population of Guernsey. We asked them to come on this journey, and they came on this journey with us. And to me, it's been a real, and I know Guernsey Together, it really has been a Guernsey Together journey that we've been on. And what we now need to do is look at where we are and look at how we can move on. So the day we went into lockdown, we started thinking, well, how do we exit? And but I think we need to be very careful with any plan forward that we don't lose those gains. But I always said from the beginning, we've got to think of the whole well-being of the island. So the health protection, the risk of an infectious agent is one, but the wider health and well-being of the island is also important. So people in lockdown, for example, may drink more alcohol. So there are other health harms that can occur as well. So what we're trying to do is balance those risks and harms. And it is imperfect because there's never going to be an absolutely right or absolutely wrong answer. What we're trying to do is what we think is the best fit forward.
With the numbers that you're seeing now, and you've talked about flattening the curve, do you expect the numbers to plateau?
I would expect the numbers to go down by the day. And actually, only 12% of our cases are being detected through unexplained community transmission. That curve is flattening. The curve that is still going up gradually is the contacts. Those are people that we're actively looking for. And when you ask me about the symptomatology, is if someone is remotely unwell as a contact, we'll have a very low threshold to test them. The other question I was asked last time was about asymptomatic transmission, and we've been specifically looking at how many of our cases are asymptomatic. When we've done blanket testing of, for example, a group of staff or a group of patients, we have found some asymptomatic cases, and if my memory serves me correct, that's in the region of about 5 totally asymptomatics that we've detected. Now, we don't know how many asymptomatics are out in the community, so when we've done our modelling, we've modelled for an increase in numbers to allow for 40% asymptomatic transmission. So we've tried to include that into our modelling assumptions.
Okay, got time for one more question. Laura.
Well, just quickly, actually, Dr. Brink, when you were talking, I was just thinking, I know you can't talk individually about cases, but a couple of weeks ago you told us that a teenager, I believe, was unwell in hospital with coronavirus and 3 infants had been tested positive. Are you able to give us an idea of how they're doing? Are the babies all in the recovered figures yet? Are they all doing well?
So they're doing really well. I'm not sure where they are on the trajectory, but all of them did really well. So we're really encouraged with that.
No, that's good news. Thank you.
Good. Okay. Well, thank you very much for today. We will resume at plan is to resume at 1 p.m. on Friday. So the information in relation to the COVID-19 response appeal will be available, as will further information on the financial support measures that we've talked about today. That will be available. All of that will be available today. The final message from me is in relation to speeding. We continue to receive a number of comments in relation to the fact that people are apparently exploiting the empty roads if they are driving on them and going at excessive speeds, and that is causing concern to other members of the community. So please, please do keep your speed under control. It may be tempting if there's an empty road, but you don't know what's around the corner in terms of families walking or with bicycles. And the last thing we want is a tragedy and Peter in his hospital having to deal with that as a result of excess speed. The police are taking it very seriously, and so your prospect of getting caught is significantly greater. So please avoid it. Final message. Thank you very much. See you Friday.